Could we now health issues, which Dr. Jackson will take up, and then we'll open it up for Q&A.
So, from Francesco, you heard a lot about the economic issues and the legal issues going on, development. Anitra always speaks about the environmental issues, the oceans, the fisheries, all of those things. Now, how does that all work together? And why do you have a doctor sitting here at the table for the first time? I was commented earlier that they've had many PhDs speak here, but I'm the first medical doctor. And that makes things tricky because not only are you having strange expectations from me, but I have to pull a little bit of his, a little bit of hers, and a little bit of my own all together and see what is happening currently in the Pacific region and what is likely to be happening in the next 50 years. Now, this is incredibly complex because we're talking about a huge region. They've gone through the numbers on the size, the volume of the ocean, some of the countries and their populations, and the expected growth in populations in those countries. But the diversity between each country, we're looking at countries like China with around 1.3 billion people, and then we go down to tiny little islands with a few thousand people. Now, their issues are going to be very different. Their economies are very different. Their access to health care is very different. So to try to make some generalizations is very difficult. But there are some common themes, and there are some things that we can look at that can be improved across all of these countries, and some of these issues that we can look at what's currently happening in the wealthier countries and see what may be happening as other poorer countries develop. Now, we hear a lot about healthcare spending in the United States. We know that the United States is spending a fortune on healthcare, and we're not necessarily getting what we pay for. Now, in the Pacific region, we look at healthcare spending as a percentage of their gross domestic product. Now, that ranges from a low of around 2.5% of their GDP spent on healthcare in Indonesia to a high of 18.9% of the GDP in the Marshall Islands. But the Marshall Islands has a tiny population, so it's still, even though it's a large percentage, it's almost nothing. Okay? Some countries are so poor that their healthcare spending per capita is as low as $85 per year. Okay? Now, if you think about that, $85 per year, you can't get anything for that. It might as well be nothing. You can't cure anybody of anything for $85. Well, I've cured a few people in Haiti for less than that, but I'm generalizing. $85 doesn't go very far. Okay, so we also have to look at their access to doctors and nurses. Now, we think of the U.S. Right now, I'm dean of a medical school, and all of my students are thrilled because we have a supposed doctor shortage in the U.S. Now, this is based on the projections of an aging population and all of that. But we have about 2.4 physicians for every 1,000 people in the U.S. So how does that measure up? So Japan is close to the U.S. They have about 2.1 per 1,000. We look at places like Papua New Guinea, and it's 0.05 per 1,000. So where we have one for every 400 Americans, they have one for every 20,000 in Papua New Guinea. That is not even close to what they need. Okay? If we have a shortage in the U.S. with 2.4 per 1,000, then Papua New Guinea basically has none. Now, some of the European countries, they have as many as around 4 per 1,000, but the U.S. is doing pretty well with 2.4 per thousand. So we need to increase the number of doctors in some of these islands. Okay, Papua New Guinea has a lot of issues. Indonesia needs more. Many of these places throughout the Pacific, there's isolated islands, and the doctors can't reach them. Okay, now we can hope that, well, if they don't have doctors, maybe they have nurses. Unfortunately, that's not the case. The majority of the countries that have very few doctors also have very few nurses. So we need to change that. Okay, now whether that is something we need to take care of through the education, which I am a strong advocate of educating the people in their own country, because we have a terrible crisis of the brain drain. When I was in Haiti, right after the earthquake, I spent almost a year there. After dealing with the emergencies, then we moved on and starting with prevention. And then I helped open a nursing school with one of the nonprofits. Anitra's nonprofit that I'm also on the board of directors was involved with that. We opened a nursing school to educate the people there. A month or two ago, there was an article that said that Haiti is one of the worst countries affected by the brain drain. Nearly 80% of the people who were born in Haiti and have bachelor's degrees are living outside of Haiti. Now, we have the same issue with the brain drain in the Pacific Islands and Indonesia and certainly elsewhere. So if So the Philippines, I just hired a doctor at my university from the Philippines, so I see this firsthand. I'm sorry, I may be part of the problem. So, but these countries need to educate their people in their own country, and then we need to give them some kind of reason to stay. Now, pride in your community is one issue, but they need to be able to have a quality of life for themselves and their families. Otherwise, they're going to leave. Okay, so that's a difficult balance, and it may be nearly impossible. I don't know how we can get professionals to stay in a place like Papua New Guinea or some of these other impoverished islands. So maybe some of you can help with some of those issues. Now, besides doctors and nurses, we also need beds in hospitals. That requires funding. That requires planning. That requires doctors to take care of the patients in the beds. You can have a bed for every person in the country, but if you don't have doctors there, then they'll just be sleeping and dying there. Okay? So we look at the numbers for the number of hospital beds per capita. We look at Indonesia, 0.6 hospital beds per 1,000 people, and 1.3 per 1,000 in Kiribati. I'm sorry, I may be pronouncing that horribly. But, so how does that measure up? Look at the U.S. We have approximately 3 hospital beds per 1,000 people. Okay. China is ahead of the U.S. They have 3.8 per 1,000. And Japan is significantly ahead of the U.S., 13.7 hospital beds per 1,000 people. And yet there are times when they don't have the hospital beds in the right department of the hospital. So I know that maternity wards and emergency departments in Japan have been neglected in the number of beds. So I hope that has been corrected. But they used to have reports of women driving around in the ambulance for hours looking for a hospital with a space in Tokyo. So all of those issues, we have shortage of doctors, we have shortage of nurses, we have shortage of hospitals and beds. But at least nothing else is going on, right? Well, unfortunately, the Pacific Rim has some of the worst natural disasters. You look at volcanoes, earthquakes. You've seen some of the most devastating earthquakes in history are happening in the Pacific Rim because that ring of fire there. Okay, you have the tsunamis that go along with the earthquakes. You have the typhoons and hurricanes. Okay? The flooding. All of these things are horrible crises, and they affect not only the physical health, but also the psychological well-being of these people. If you are affected by an earthquake and a tsunami, it's going to take you quite a while to be able to get on with your life. So we need to deal with those issues. We need to have mental health care. We need to have prevention to reduce the casualties. And all of this needs to be done in advance. Okay? When you have an earthquake of 8.0 or 9.0, you can't deal with the number of casualties after the fact. But if you plan ahead and devise these systems and design buildings properly, you can minimize the impact. And then you can try to work with fewer casualties and less damage. Okay? So we need to be investing in infrastructure, better buildings, okay? Better education. If we educate the people about disaster management, we can save lives. Okay? A large number of the casualties in earthquakes and hurricanes are preventable just by educating them. Tell them to get away from those areas. Tell them to avoid certain things. Tell them to avoid standing under a building that's going to be collapsing. Simple things can be done. The cost isn't significant, but it does require innovation, education, and intelligence. So, over the next century, some of these things may actually increase. So some of the climate models suggest that the typhoons and hurricanes may be increasing. The flooding may be increasing. So we need to deal with this. We need to plan now. All right. With all of these things, what else is happening? Okay, we're looking at flooding. We're looking at natural disasters. Let's look at the diseases. When you have flooding, you have mosquitoes. When you have flooding, you have sewer water that's getting mixed in with the drinking water. Okay? The Pacific Islands have some of the lowest access to clean water of anywhere in the world. The only place with less access to clean water is sub-Saharan Africa. Okay? And this also ties into the fact where a large percentage of the Pacific region is dependent on surface water rather than processed water. And when you combine that with they're defecating in the open or in improper sewage facilities, so it's leaking into their groundwater and their surface water. And so we get things like cholera. We get spread of terrible diseases that are entirely preventable if we can just educate the people, invest in infrastructure, start improving their vaccination programs. Some of the disease that is killing so many, tuberculosis, malaria, dengue fever, HIV. Hopefully within the next decade or two, we will have vaccines that will be able to prevent or cure some of these people. We're working on that. But right now, education and infrastructure are going to be of more value than almost anything else we can do. Now, all of this requires funding. All of this requires political influence. So we need to convince the leaders that it's more cost-effective to invest in education and prevention rather than dealing with the massive disasters after the fact. So I'm going to end a little bit early to allow more time for question and answers. So feel free to ask whatever you need later.
Thank you very much, Dr. Jackson.